Hello, my name is Jean O'Connell and I'm one of the doctors working in the Centre for Obesity Management in St Columbkille's Hospital. There are two physicians or medical doctors, myself and Donal O'Shea, and there are two surgeons, Helen Hennigan and Naomi Fearon. You'll also meet specialist doctors gaining experience in obesity medicine and surgery, called clinical fellows, and doctors who are training to be GPs. I would love to be confident that all consultations with doctors are as friendly and open as it appears in this picture. Unfortunately, I know that the opposite is probably the case. Many patients have shared with me a whole range of negative experiences they have had in the past with doctors and also with other healthcare professionals. We are actively trying to improve education and training for all healthcare professionals and students, so that weight bias and stigma in healthcare settings are reduced. Weight bias is when a person has negative attitudes and views about people with obesity. Weight stigma is the manifestation of weight bias through harmful social stereotypes that are associated with people living with obesity that can become deeply rooted in society. Weight bias and stigma can lead to discrimination, which is unjust treatment of a person because of their weight, and this can take place in schools or workplaces or relationships with other people. Unfortunately, it can also happen in healthcare settings. Examples would be if a health professional was using insensitive or stigmatizing language, or not listening to why you came to see them, and if they are blaming all your problems on your weight. One of the most harmful forms of bias and stigma is when it becomes internalized. This means that you hold negative views and opinions about yourself. This can make it much harder for you to manage your weight and your health. Studies have shown that experience of stigma has many negative effects. It's very understandable that it has negative effects on your mental health, your self-esteem and self-confidence. But it's also been shown to have negative effects on your physical health, as it's associated with increases in blood pressure, the stress hormone cortisol, and also increases in inflammatory markers. These are harmful for the metabolism. Experiencing stigma is also associated with unhealthy eating patterns, increased calorie consumption, less motivation to engage in physical activity, and a very understandable reluctance to attend healthcare settings and interact with healthcare professionals. Stigma often arises out of misunderstanding and lack of knowledge. So the team at St Columbkille's Hospital have an ongoing programme of education for health professionals. We explain to them that obesity is not a choice, but a complex chronic disease that is influenced by multiple genetic, biological, and environmental factors. The list on this slide includes many, but not all of these factors. And I have highlighted here genetic predisposition because it's such an important factor. And the contribution of your genes to your body weight can be up to 75%. Now, it's important to know that this doesn't mean there is nothing you can do to modify your genetic risk or the hardwiring of your genetics. But it does explain why you may have to work harder than other people with a different genetic makeup. The different factors on this slide can all contribute to weight gain. They can mean that losing weight is challenging, and why it's so common to regain all the weight that you have lost. This is why we encourage health professionals and patients to focus on health gains rather than weight loss. And we're working towards creating healthcare environments that are safe and welcoming spaces for everyone, for all of these reasons, but primarily because everyone deserves to be treated with respect and compassion. Obesity is very complex, but the simple key messages that I would like to emphasize today are that obesity is not your fault. It is a disease. It's not yours to manage alone. It's a worldwide health concern, and it's our job, as with other diseases, to help and support you. It's not just about food, it's caused by many factors. And it's not cured by a miracle treatment, but it is treatable and manageable. You may have had unhelpful conversations in the past with doctors who told you to lose 4 or 5 or 6 or more stone. But they may not have told you that with just 5 to 10% weight loss, or even just preventing further weight gain and achieving weight stability, you can see significant improvements in many important aspects of your health. So 5 to 10% weight loss can be associated with reduced risk of diabetes, or if you have diabetes, improvement in your blood sugar levels. You can see improvement in cholesterol, reduction of your blood pressure, improvement in sleep apnea, and a lower risk of heart disease. And if you can just manage to keep your weight stable, which sometimes is all we can deal with at a particular time in our lives, and in that case, we can still have improved quality of life, improved balance and mobility, reduced pain, and improved sleeping pattern, just from stopping ongoing weight gain. So rather than focusing exclusively on a specific weight loss goal, we encourage you to focus on improving health and well-being, which is so much more important than the number on the weighing scales. At your first visit, the doctor will take a history of any current or past medical illnesses. They will ask you for a list of your medications, do an examination that includes a check of blood pressure, and take some blood tests. It's very important to bring a list of your medications with you. Or you might take a photo of your prescription with your phone, and then you can show that to the doctor in the clinic. There are some medications that can contribute to weight gain or make it more challenging for you to lose weight. And we would like to know if you're taking any of these medications. That's why it's so important that we have the full list. We can consider if there might be a potential alternative medication that could have less impact on weight. Unfortunately, in the area of obesity treatment medication options, we still only have a small number of options, especially when you compare obesity to other diseases such as diabetes and high blood pressure that have a whole range of different medications to try if one doesn't suit or isn't tolerated or isn't effective. This situation is changing, and hopefully in the near future we will have more options to choose from. For now, there are 3 medications licensed for obesity treatment in Ireland. The first is Orlistat, and this is a tablet that's taken 3 times per day, and it reduces fat absorption from the bowel. It can be associated with a modest degree of weight loss and also some side effects such as diarrhea. Naltrexone bupropion is also called Mysimba. This is a tablet that can reduce hunger and help control food cravings. However, not everyone is suitable to be able to take this medication. There are some medical conditions that you might have that would mean you aren't able to take it, or that you would require additional monitoring. And if you're taking certain other medications, it's not safe to take this medication with them. So if you're interested in trying this medication, you can discuss it in more detail with the doctor at your first clinic appointment. Liraglutide is an injection medication. The other name, the brand name, is Saxenda when prescribed to treat obesity, and the brand name is Victoza when it's prescribed for people with diabetes. It's the same drug in both cases, but the dose is usually higher when taking it to treat obesity. The injection is given once daily, and you're shown how to do this yourself or by one of the nurses here or your practice nurse. In some people, this medication can help to reduce hunger and help you feel fuller for longer. It can help support weight loss when used then in conjunction with healthy eating, movement, sleep, and stress management. There are similar drugs such as Ozempic and Wegovy that are given once per week. Ozempic is available in Ireland, but it is not licensed for treatment of obesity, and Wegovy is still not available in Ireland, but hopefully will be available soon. If you're interested in trying this medication, you can discuss it in more detail with the doctor at your first clinic appointment. Unfortunately, most people are unable to access reimbursement for any obesity treatment medications under the medical card or the drug payment scheme, unless you also have diabetes. Saxenda was approved for reimbursement for people who do not have diabetes, so just purely for treatment of obesity, in January 2023. But the criteria that say that you're eligible to receive this reimbursement are quite strict, and unfortunately many people are not eligible under these criteria. We can discuss your individual situation with you when you attend the clinic, and we'll let you know if we think you may be eligible for reimbursement. I'd like to also emphasize that many people who attend this clinic do not want to have bariatric surgery, and that is completely fine. You're still in the right place. About 50% of people who attend the clinic do not go forward to have surgery. If you are interested in having bariatric surgery after you've attended the appropriate number of appointments with the multidisciplinary team, we may discuss this with you if the team agrees that it's a safe and potentially effective procedure for you. We no longer perform the gastric band surgery as there were many complications associated with that procedure. The main two surgeries are the gastric bypass and the sleeve gastrectomy. If surgery is something you are considering, we can discuss this in more detail with you, including the risks and benefits of each type and which may be best suited for you. Thank you for listening, and we look forward to meeting you.